Hi, welcome to Some of Your Parts podcast. I'm your host, Dr. Betsy Greenleaf, premier pelvic health expert and women's wellness warrior. Join me as we discuss women's wellness topics and discuss tips and tricks with top elite health experts, and where you'll discover that you're greater than the sum of your parts. And don't forget to like and follow this podcast and the YouTube videos so that I can keep bringing you great information. Also, follow me on Instagram at Dr. Betsy Greenleaf. On today's episode, we'll be talking with Dr. Andrea Perez. She's the host of the upcoming Heal Your Fibroid Pain that's starting January 18th. You can find more information about this free summit at spiritualmedicinehealyourfibroidpain.com/speaker/BetsyG/ and we'll put that link in our podcast information. But Dr. Andrea Perez is a board-certified family physician with over 20 years experience. She's extensive training in pediatrics, gynecology, and adult medicine. She's also the founder and owner of Health Development and Restorative Medicine in New York City, where she sees her private patients, but she also works one-on-one with patients across her country on her virtual platform, The Spiritual Physician. I'm very excited to have Dr. Perez with us to talk about all she's doing and her upcoming summit. So I'd like to welcome with us today Dr. Andrea Perez. Thank you so much for being with us.
You are so welcome. Thanks for inviting me, Dr. Betsy.
So I'm so excited. You have this summit coming up soon. What is your summit called and what is it about?
Oh, yeah. Well, wow, it's so exciting to me. The name of my summit is Heal Your Fibroid Pain. Discover how to intuitively, naturally, and with power heal your pain. And the whole basis of this summit is really for women to be able to have all the options, right? I have no energy behind the fact of whether you want to have surgery or if you want to like go up in the hills and meditate for like hours on end. It's all good and it's all necessary and it's all needed, right? So I think that women, sometimes we think, okay, I can only do this or I can only do that. And with the hopes of this summit is to bring in experts like yourself to really give us women an idea of how it is that we can heal our pain, all the options that are out there, and then we take it in, we sit, we're quiet, and we trust in our intuition to be able to make the best decision for our own body. So that's really the hopes of this summit.
So what made you go into that field of work? I know I get asked that all the time.
Well, you know what? Many people think that I'm a gynecologist because I have such passion around women's health. I'm actually board certified in family medicine.
Oh my goodness, that's awesome.
Yeah, so I'm board certified in family medicine. And obviously I do, well, or maybe not so obvious, I do a lot of gynecological. I used to do OB a very long time ago, and I won't date myself, but I do not do that anymore. And so throughout the years, I've really have learned and seen the importance of like teaching women about their bodies, right? You would be you're not surprised, you're a gynecologist. So surprised how many women don't know what normal looks like, right?
Yeah.
And it's like the first time we do, and I have had the privilege and honor of being like the first person to do a pelvic exam on them, right? Because since I do family medicine, a lot of these women have followed me throughout the years since, their early teens and now they're in their 20s and 30s and, in their 20s and having their first pelvic exam. And I've really had the pleasure and honor of being able to like let them have a good experience and let them and teach them like, this is what this looks like. This is what you should look out for. And it's just been a really good experience for me and for my patients.
I love that because, it's not as common today, but that for family doctors to do everything. but you're trained in everything.
That's right.
And that's so nice for women to be able to go like one-stop shopping, under one roof, and to
Yes.
get, and also to follow with somebody from beginning to end. I mean, really cover everything.
Yeah.
So, but what was it about fibroids that made you decide that, all right, I need to get this information out?
Well, I got to tell you, I have a personal story with fibroids. I have really suffered with fibroid pain, fibroids most of my adult life. And I have gone to doctors who have said, well, aren't you done? Like, you're done, right? Like, so remove your fibroids. And it's like, wait a minute, remove not only the fibroids, but you can just remove the uterus. And it's like, okay, listen, every time you have a pain in your testicles, I don't remove them. That's not the first option, right?
Yeah,
It's
yeah.
not. So why do I have to remove mine, right? And I've also had a lot of experience with herbs and supplements. I've done acupuncture, and all of it has helped me to be on this side now, which is really pain-free, And I think that my goal is to really tell women and to show them that this is possible. It is possible to be on the other side. I've had 2 myomectomies. Like I said, I've done herbs, supplements. I continue to do, prayer and NLP, right? We had talked about that on our show, neuro-linguistic programming. And I know that there's an energetic piece to the womb, right? And I think that if we don't stop and really listen and go in to that inner knowing, that peace that's deep within us, right? And take the time to listen, we never really heal. And I got to say, it wasn't until I really stopped and listened and said, what the heck is my body trying to tell me, right? Like I eat well, right? Especially by American standards, I eat very well. I exercise, I maintain, more or less a healthy weight, and everything else is fine, right? Like, I don't smoke, all of those good stuff, right? I do like the right thing. And yet, here I was in my 20s with fibroids, right? And it continued on for a very long time. And I do know that what really, I think, made a difference outside of bringing it all together was tapping into that spiritual, energetic piece of the womb.
I think that's important. I'm going to get back to that, but I just realized that for people who are listening, if you have fibroids or you know somebody who's had fibroids, you know what we're talking about. But there might be people out there like, what are fibroids? Do I have it? Like, what, can I get it?
How do I know I have it?
Is it contagious? So what is a fibroid?
Yeah, right. Great question. So fibroids are really benign tumors that it can grow within the uterine wall. It can grow outside of the uterine wall. It can be what they call pedunculated. So it's kind of like a stalk. Like, if you think of like a stalk, like hanging somewhere off of the uterine wall. And for the good news is that they are benign. I mean, 99.99% are benign. And what happens is that sometimes women can have a variety of symptoms depending on where those fibroids are, right? They can have urinary incontinence, right? Which means like you can't hold your urine. The minute you got to pee, you got to go or it's gone, right? So you can have that. You can have pain with sex, right? You can have, you can see that your belly is growing in size and you're like, okay, what's going on here, right? I'm everything else is fine, but my belly looks like I'm, 3 months pregnant, 6 months pregnant. What is it that's going on? Some women feel very tired with fibroids. And the reason why is because they're having very heavy periods, right? And when we have very heavy periods, on average, we have a lot of cramping and pain and we lose hemoglobin, right? Like, we become anemic. I can tell you a story that this was quite a few years back, and it was actually around the holidays, which was really interesting. I was running up the stairs. I was going to Nordstrom's and I was running up the stairs like, I forgot that one item. And I had to stop because I was so out of breath. And I was like, what the heck? Okay, I haven't been working out, but what's going on? And I went back, and thankfully so my body was like, you know what, you need to get some blood tests, right? And I listened. More importantly, I listened. My hemoglobin was like at 7, which for our
Ooh.
audience is really low.
Yeah.
No wonder I was out of breath, right? There wasn't enough oxygen running through my blood. There wasn't enough hemoglobin to carry the oxygen to run through the blood. And that's a real issue and that's a real concern. But we get so used to just being tired that we don't even recognize that we're tired. And we don't think that there's much that can be done. And I'm here to tell you, there's possibilities out there. It can be done. You can live, a fruitful, happy, fulfilled, tired-free life, free of fibroids. And that's what we're here to show you.
So what are some of the options for people that have fibroids?
Oh, wow. There's a myriad, tons of options. So let's go from one end to the other, right? So procedure wise, we can speak of myomectomy, right? That's when we actually go into the uterus and kind of like scoop out the uterus. I mean, sorry, not the uterus, the fibroid. We scoop out the fibroid and we try to remove as much of the tumors as we see, right? And then kind of like your uterus is placed back in your belly, and you can have like a small scar, almost like that bikini scar, best case scenario, right? And then you have the hysterectomy, right, where sometimes women have to get the whole uterus removed because they're just so abundant, or the bleeding is so much, or there are a lot of different reasons why you may have to do that. Then we have diet. Diet and exercise are really, really important because with fibroids, we know that they're really like estrogen based, right? So we want to be able, as you know, Dr. Betsy, is we want to be able to decrease the estrogen in that we're ingesting, that we're taking in. But as we know, there's also a lot of estrogen around us in the environment and plastics. We were just speaking of this, right, Doc? About the plastics the plastics that we're drinking from, that we're eating from. But diet, as far as having more of a plant-based diet, low on animal fat. I am not a vegetarian, but I do go through periods of time, especially maybe on a weekly basis, where I really focus on being plant-based, right? So not every meal is meat-based, but we still get to have our protein, right? Where was I, Doc? I lost my train of thought.
I know there's so many options. We were talking about like diet and exercise affecting hormones and therefore
yes, and acupuncture is another fabulous treatment. And I actually had done acupuncture for myself also. So acupuncture, as you know, works on the meridians, and there are certain points in traditional Chinese medicine that really work to increase the blood flow, increase the qi, and really I guess I don't know if acupuncture is considered an energetic field of medicine, but I'm not sure if it actually falls under energetic medicine. However, it really is a hands-on treatment that can help to decrease the size of your fibroids, and along with detoxing your liver, cleansing your kidneys. There's just so much that's out there that we can do. Abdominal massage, key, right? Key in really looking at the health of the pelvis. Pelvic exercises, right? We have some experts that are coming on to talk about, well, some of this visceral somatic piece, and how the pelvic pain could really be secondary. Yeah, you have the fibroids, and that's true, and you have that pain, but then there's also this referred pain, this visceral somatic pain. And since the fibroids sit in the uterus, right? And the uterus sits in the pelvis, it only makes sense that you get to address the whole health of the pelvis in order to also support and address the pelvic pain, or the pain secondary to the fibroids.
I want to get back to that energetic like
The energy
energy
medicine.
in the energy medicine like fascinates me. I have a couple
Hmm.
close friends that are energy practitioners, and as a scientist, I just can't understand what they do. I believe in it, but I can't rationalize it, and I've seen them do some strange, like crazy things with affecting our energy. But if you think about it, though, it makes sense because that's all we are is energy, down to our atoms. I mean, you got like atoms and protons and neutrons spinning around. It's all energy.
It is all energy.
So the one thing that always blows my mind that my friend, my energy medicine friend tells me is that the energy from our grandmothers
Hmm.
can be passed down to us because we were in our grandmother's womb, like in our grandmother's body. And I always go like, I have to think about this because like when she explains it to me, I'm like, what? And she's like, okay, so your grandmother was pregnant with your mother, and you have all the eggs you're ever as a fetus, you have all the eggs you're ever going to have in your life when you're before you're born. So you were an egg inside your mother, inside your grandmother. And I go, like, every time I think about this, my brain just hurts. So,
You're funny,
and
Dr.
she
Betsy.
explains that like your grandmother's energy can actually be passed down and affect your health today. And I'm like, I just go, pooh, my brain's blown.
Yeah, well, you know what? She's right. I mean, there is a lot to be said about ancestral wounds, right?
Yeah.
And what happens there is that sometimes we pick up information and you wonder, well, why do I think that? That's never happened to me. I mean, I'm sure someone in your audience has some idea of something and is like, but I never experienced that. So why am I like trembling? Why am I having like this response of like flight or fight? Like, like getting upset or getting sad or getting tearful, getting fearful, right? When I have personally never experienced this. I would say go back and check to see who in your family has, because it really it is that wound as well. So the good and the bad gets passed down, right?
Yeah.
You know
Yeah.
how like families are like, oh my gosh, you're just like Grandpa Joe, and
Yeah.
you've never met Grandpa Joe, right? And Grandpa Joe is not in your life, right? He passed before you came into this plane, and yet you're just like Grandpa Joe. And why is that? Because that type of energy, energy is never lost, right? It's just
Yes.
transmuted, right? Or transformed. So the same idea happens when there's pain, when there's trauma. And what we get to do is really address that ancestral pain, that ancestral wound, in order to stop it here with you in this generation, so that it doesn't get passed on to your child and to your grandchild and so on and so forth. So I would liken it to, maybe this will help, to like quantum physics, right? Like
Yeah.
we know quantum physics really is out there and it exists, and all the energy of it works. And so what we get to do is really, address that also. So journaling is a great way to start, figuring out like, well, where did this come from? When I personally myself have never experienced this, and working with an energetic practitioner to really get to the core of it, I think is that's where you get to spend your money.
Yeah. And I love this because a lot of this has to go with like Eastern medicine. So like,
Mhm.
in Western medicine, everything for us is very, very cut and dry. Like you
Yeah.
have a condition, here are the options. You have this symptom, here's the medicine. Where a lot of the other integrative, alternative, and even Eastern philosophies are more looking at your energy and where does your energy become stagnant, and how when it becomes stagnant, that how it can end up in disease. And so same thing with my friends who are in energy medicine have talked about how the womb and the pelvis is your creative energy.
Yes.
And that a lot of, I know, this is something I do know, and I see in my pelvic pain patients all the time, is women hold their stress in their pelvis. And I see it all the time. They tighten and they don't even realize that they're tightening. And so, it's this idea. Now, I have no clue how you let that creativity and that energy, go, but
we need to work together then, because I know.
Oh my goodness. Well, tell us a little bit.
Well, it really, so here's the thing, Dr. Betsy, is that we all have the inherent ability to heal, right? We really have the answers that we need for our own particular body. However, we just get to tap into that knowledge, right? We need to trust that knowledge. And how that really works is, wow, there are so many ways, but how we really get to work that is by going in and really listening and journeying to that spot where, it all started. And it may not, it's like anything else, right? It's not like a one session and, one and good, you're done. No, it's a process that we get to go through to remember where and why. And sometimes I got to say, it's not even knowing the why, just the conscious acknowledgement that it has happened is sometimes enough to just let it go.
I love this stuff.
So yeah, I mean, that's part of it also. So I love the, I mean, I love so many things about the body, about, energy, spirituality, and the pieces is that, as family medicine, as I'm like I mentioned, board certified in family medicine, but I'm also an initiated priestess. So the idea of blending spirituality and medicine, has always been part of what I do. And I think what's happening now is that, it's just more accepted and people don't feel so woo-woo-ishy when we're speaking about this. And we really get to have more people like you, Dr. Betsy, that are also willing to bring in and integrate all of us, right? All of it, because it all matters and it's all necessary and it's all a piece of the puzzle. And if we don't, then we're really just, once again, masking symptoms. So I love addressing energy medicine. I think that, our patients or my patients really get success in addressing it. And each one is different. There's no one formula that fits everyone.
So your summit's coming up. What are the dates for it?
Yeah. So the summit, super excited, starts January 11th. It's for 21 days. So each day you'll get a really friendly, I know we're in a busy, it's the holidays, right after the holidays, the busy time. We're all busy. 30 minutes, concise, give you what you need, and starts on January 11th with 21 different speakers.
That is great. And where can people find out more about it?
Yeah, so we can, you can be, that's a good question. Oh my gosh.
The trickiest question of all.
That is the trickiest question of all. I was like, yeah, where can we find out about it? Actually, we can find out about it at www.thespiritualphysician.com. It will be posted on my website. Wow, that took a minute.
That's great.
Yeah, www.thespiritualphysician.com.
Great. And they can find out more about you at that location too, right?
Yes. Where our website, everything is in a flux, 2020, everything's just a little nuts, but be patient with me and all that information will be there definitely before the summit.
I have the same problem. I keep sending people to my website, which is drbetsygreenleaf.com. And we're working on it.
Yes, we're working on it.
With balancing kids being homeschooled, the world coming to an end with this pandemic. No, I'm kidding. Like so much stuff. We're getting to it.
It'll be up before the summit. I promise.
Great. Well, thank you so much for being with us today. Really appreciate it.
Betsy. I really appreciate it also. And many blessings, health and blessings to you and to your audience.
Great. Thank you. Since the time of this recording, Dr. Andrea Perez has updated her summit to start on January 18th, 2021. You can find more information here. Also follow me on Instagram, Twitter, Facebook, for updated links to this wonderful summit. I'm excited to announce the premiere of my new show, Body, Mind, Spirit, starting January 13th, 2021. It'll be airing 8 p.m. Eastern, 5 p.m. Pacific on wytv7.org. Specifically, go to wytv7.org/body/mind/spirit to find out more. Now you'll have 2 great shows to watch. Today's episode was brought to you by the Pelvic Floor Store, your source for personal health. You can find us at www.pelvicfloorstore.com. For more information on today's episode and women's wellness, please go to drbetsygreenleaf.com.
Feel the people, feel alive.